Alcohol drinkers might be told to dig even deeper in their pockets come the 2025 budget speech. The National Treasury is calling for comment on the latest alcohol taxation review, which could see significant changes to the pricing of drinks. Let's talk some more about this with the project lead of the DG Murray Trust Alcohol Harms Reduction Campaign, Zimasa Mpenyama, who joins us virtually from Cape Town. Zimasa, thank you so much for your time. A part of the changes could see a minimum unit pricing for alcohol, and it's something your campaign and organization has been advocating for some time. Why do you think this could be a game changer?
Good morning, Marcel, and thank you again for having me on the show. So we have been campaigning for minimum unit pricing to be included in the way in which we calculate the excise tax on alcohol. So minimum unit pricing is not tax, it's a price limit that is set on the lower bounds of alcohol to make sure that alcohol doesn't go below a certain price. And this is to curb heavy drinkers from being able to access alcohol freely, because South Africa has some of the cheapest alcohol in the world. And that contributes to the scourge of heavy and harmful drinking in the country. And so we've been advocating for this measure to be used by the National Treasury so that it can be able to curb the harm that is associated with alcohol that we see. And we also advocate that this mechanism is used with other mechanisms that is brought forward by the World Health Organization, including looking at trading hours, looking at regulation, looking at advertising, and looking at providing psychosocial support to people that already have dependence on alcohol. Sorry,
Zimasa, I wanted to ask you, in terms of cheap, high alcohol products, how freely accessible are they in South Africa? And how much of a golden thread is it if you look at South Africa's big issue it has with problem drinking?
Sure, thanks for that. So we have a very big issue of cheap and easily accessible alcohol in the country. This dates back to colonialism, to apartheid days, where people were paid using alcohol in the winelands in the Western Cape.
The DOP system.
And that threat, yes, the DOP system, and that threat still exists to some degree in the Western Cape, but we still see bits of this existing, and it has created a culture where people are now to access cheap alcohol. You have 5-liter containers of wine, you have 3-liter containers of wine that are easily accessible at like 150, 180. And this then creates a culture where people then depend on alcohol, and then the alcohol is freely accessible to them. But also the other thing here is that this cheap available alcohol is easily accessible to minors as well, and is easily accessible to young kids that can easily put together a little bit of money to buy these large quantities of alcohol. That creates then a dependence issue that we're seeing in communities. And some of the things that we've been advocating for are making sure that liquor establishments don't allow young kids into their liquor establishments, looking at the age of drinking, looking at the advertising, and making sure that we have a whole of government approach that looks at curbing alcohol harm. But this step by the National Treasury of looking at excise taxes and looking at minimum unit prices is a step in the right direction, and we are happy to support them in this regard.
Based on your research and what we've seen in terms of best practice internationally, because certainly South Africa is not the only country that has a problem with binge drinking. That's sort of seems to be the phrase that's become quite popular. How much of an impact could these kinds of changes have on the various other social ills that stems from problem drinking?
So internationally, as the DG Murray Trust, we've commissioned research from the University of Cape Town. This is research dating back to 2021, 2020, that looks at comparing South Africa to the international audience and looking at different countries that also have similar patterns of drinking, and looking at how this minimum unit pricing could be applied in South Africa. But the research was looking at the Western Cape specifically. And we see countries like Scotland, like Russia, like Australia, that have improved their statistics around drinking and binge drinking, and improved the harm that is then associated associated with binge drinking using these tools that have been put forth by the World Health Organization. And this is something then we want to start seeing in South Africa so that we can curb harm associated with alcohol. And the only way for us to be able to see whether these mechanisms work in South Africa is through implementing them and putting them in policy and making sure that they are part of our legislation. What is nice and what we are noting with the contribution by the National Treasury is that they are using evidence-based solutions that are based on research, based on international outlooks to input into their policy making, which is something new we haven't seen in the space. We've seen it with the Department of Social Development in their prevention policies, and we're now seeing it with National Treasury. So we are now seeing an outlook from government that says it's important to look at the World Health Organization specifications, but it's also important to look at the research that's emerging in South Africa. And I must say the research is emerging. We've plowed into making sure that we are funding researchers to do this work, but we are also now wanting to see what the policy, what implementing this in policy will look like, and we are hopefully wanting to see something similar to how we saw in tobacco when the legislation there was changed.
National Treasury is calling for comments on this, and I'm sure your organization is encouraging, especially those communities impacted by problem drinking, to make their voices heard.
Yes, so we're definitely commenting as the DG Marie Trust, but we're also encouraging people in the civil society space who work in alcohol harms to comment as well. And we're also encouraging communities. So sometimes these policies are difficult to understand and some difficult to digest, and therefore it doesn't allow for people to freely comment on them because sometimes they don't understand what's in them, but also the timing of them. So you have these policies that are coming out like a very late in the year, and people are not really paying attention. So we want to use platforms like this to encourage people to go and search for them, to read them, to search some of the easy to read documents that we've put out there that kind of explain some of these terms and terminologies, and to input, say something, put something out there, say how alcohol is affecting your community. You don't need to comment on the technicalities of excise, but also just to say that you want to see something different that is emerging in the country that will allow us to have a different relationship with alcohol going forward. So yes, we're encouraging communities to make their voices heard in the submission, and we will definitely as well be contributing to it.
Zimasa Mpanyama is the project lead for the Alcohol Harms Reduction Campaign with the DG Marie Trust. Thank you so much for your time this morning.